Have you ever heard someone call your name and there was nobody there? Or seen something out of the corner of your eye and there was actually nothing there? Everyone in this room has had some type of experience like this. We chalk it up simply to our mind playing tricks on us. However, for children and adolescents with schizophrenia, there is no line between what is real and what is imaginary. The purpose of my speech today is to inform you about childhood onset schizophrenia. I feel that I am qualified to bring you this information today because of my extensive research on the subject as well as many years of experience in a pharmaceutical setting. Childhood schizophrenia is a severe brain disorder in which children interpret reality abnormally. Today, I will talk about the various symptoms, a few types, and treatment options of this type of mental illness. First, I would like to go over some of the symptoms of childhood schizophrenia. According to MayoClinic.org, some early signs of childhood schizophrenia include language delays, late crawling or walking, or other abnormal motor behaviors such as rocking or arm flapping. Do keep in mind, however, some of these symptoms fall within the developmental disorder in the autism spectrum. As a child ages, schizophrenic symptoms become increase and mature. Symptoms found in older children include, but are not limited to, hallucinations, delusions, insomnia, irritability, and depression. Children are more likely to have visual and auditory hallucinations than adults with schizophrenia. This means that they're more likely to see or hear things that are not really there. Secondly, I would like to discuss a couple types of schizophrenia. The most treatable type of schizophrenia, according to healthyplace.com, is paranoid schizophrenia. In children, this particular type of schizophrenia presents with frequent auditory hallucinations as well as unexplained anger. Severe anxiety as well as agitation are also common in older children with this type of schizophrenia. Another type of schizophrenia is catatonic schizophrenia. In this type of schizophrenia, a child will have one end of the behavior spectrum or experience the exact opposite. They will either be extremely hyperactive or experience a dazed or coma-like state. This form of schizophrenia shares many similarities with attention deficit hyperactive disorder, also known as ADHD, when found in children. Thus bringing us to our final topic of discussion, which is the treatment options for childhood schizophrenia. There are a number of medications available for schizophrenic symptoms in children, according to the National Institute of Mental Health's website. I'm just going to go over a few today because there are many. Various antipsychotic drugs such as Risperdal, Abilify, and Seroquel are commonly used to treat symptoms in children. Stimulants such as Adderall, Ritalin, and Focalin are prescribed to children who experience the hyperactive category of schizophrenia that we discussed earlier in the speech. A non-medication form of treatment is also available for treatment in children. Psychotherapy, also known as talk therapy, is a way to treat people with mental disorders by helping them understand their illness. This particular therapy helps children to learn strategies for coping with the stresses and unhealthy thoughts associated with schizophrenia. In conclusion, the purpose of my speech was to inform you about childhood onset schizophrenia. Throughout my presentation, I discussed the various symptoms, a couple of types, and treatment options for childhood schizophrenia. Moreover, I felt qualified to bring you this information today because of my research and daily work in pharmacology. 1 in 10,000 children experience schizophrenic symptoms today, and the illness is twice as prevalent in males than it is in females. So remember, when your mind plays tricks on you next time, be thankful that you have the ability to know what is real and what is simply a figment of your imagination. Thank you.